Today, we're going to be talking about breast reduction. Breast reduction is one of the surgeries in plastic surgery that has the highest patient satisfaction rate. The reason why it does is because of the back, neck, and shoulder pain that are associated with macromastia or hypermastia or large breast. Now, I think that back pain, neck pain, and shoulder thing is caused by the weight of the breast and the fact that the weight of the breast is low, or the breast tissue is low. And I think that when you do a breast reduction, which also includes a lift, the lift is playing a role in making the back feel better, and the reduction is playing a role in the back feeling better. Now, because that lift is playing a role in improving the back, you don't have to reduce somebody to an A cup in order to reduce the pain. You really cannot reduce somebody too much with a breast reduction because the nerves to the nipple, the blood supply of the nipple are all going through the breast tissue. If you take too much of that tissue away, you're taking away too much nerve supply, too much blood supply, and you can get death of the nipple. You can get decreased nipple sensation if you take too much. I generally don't reduce people smaller than a C. And when you take away 4 pounds, 5 pounds, 10 pounds away, if you're going from a G cup to a D cup, their back pain and things is solved. Their shoulder pain and things go away. It's not that you have to have nothing left in order to treat the back pain. When you put that weight on the chest, you're doing a lot to improving the back, neck, and shoulder pains. So both the reduction in size and the lift is playing a role in getting the back, neck, and shoulders to feel better. Now, the lift that I do is a short scar central pedicle type of breast reduction. There are different types of breast reductions. The short scar breast reduction means that we're not putting a horizontal scar on the breast. We're just putting a scar around the nipple and vertical without the horizontal. The central pedicle means we are taking away breast tissue from the sides and the top of the breast. We're taking the tissue away from the outside of the breast and keeping the center of the breast to do the reduction. The most common breast reduction done in the United States is a inferior pedicle with a Wise pattern. A Wise pattern is a scar around the nipple, the vertical, and the scar in the horizontal. The inferior pedicle means we're saving most of the breast tissue from the bottom of the breast and taking off breast tissue from the top. There are also superior pedicles where we're keeping the breast tissue from the top. There's an older procedure or a superior and inferior pedicle, both. And then there's also superior medial pedicle, meaning that we're saving the breast tissue from the inside here. The idea of the superior medial is you're saving the tissue where the cleavage is. That's kind of the idea of that. But they're different types, they do different things, but what I'm doing is a short scar central pedicle. There's something unique that I do with the breast reduction is I don't throw away the extra tissue. When I take away the extra tissue from the bottom, I take off the top of the skin, which is called the epithelium, save the bottom of the skin, and then use the bottom of the skin for extra support under the breast. So now at the bottom of the breast, we have 2 pieces of skin instead of 1. Because scars never heal to the full strength of the original skin, a scar will only heal to 80% of the original strength of the tissue. Weakness in the bottom of the breast causes the bottoming out or the breast to fall again. So the more strength we have on the bottom of the breast, the less likely that is. The better we secure the breast tissue to the fascia, the chest wall, something that has strength, the less chance of the breast falling down again. So these are the things we're trying to do to give longevity to the breast lift and also to give better shape to the breast lift. Physically what you're doing when you do the breast lift is we are, picking a new nipple location. Her nipple is someplace near the level of the elbow. We'd like the nipple to be someplace near the level of the inframammary fold, which is about halfway up the arm. So we're choosing a new lip location here. Here I'm making an incision like an upside down V. I'm lifting the skin away from the breast tissue, exposing the nipple and breast tissue, taking away tissue from the sides to top of the breast, moving the breast, nipple, and breast tissue back to the chest wall, putting sutures around the breast tissue to secure it to the chest wall, and then closing the skin behind, using the extra skin to create a hammock and give more support under the breast. Breast reduction is not a terribly painful procedure as surgery goes. The pain is more a throbbing, swelling type of pain than a sharp knife type of pain. Initially, the breast is like Madonna breasts, torpedoes, and it's very high in the neck. As the swelling goes down, you get the normal slope. You get the normal slope in the shape and things like that. You're doing everyday things right after the breast, the breast reduction. You brush your teeth, comb your hair, eating, lift, moving, stretching. What you're not doing is lifting and pulling. You're not exercising, because you cannot take that. The wounds could open and things like that. But everyday things you're doing, from day one. At 1 week, the swelling will start to go down. By 2 weeks, the shape appears more like a normal shape. Most people take 2 weeks to 3 weeks off after the breast reduction. There is no exercise for 1 month. It will take 3 months, even 4 months, for 90% of the swelling to go away and to get the kind of final look and shape of the breast. It could be 1 year or even more that the scars get better and the scars look their best. First day, most of my patients are not terribly painful. I have patients that, would maybe take narcotics once or maybe the first day and not need so much the second day. It's very rare for people to need narcotics 4 or 5 days for, in my experience with this procedure. The two main complications have to do with the breast reduction, taking away tissue. The nerves and blood vessels to the nipple go through the breast tissue. So when you cut away breast tissue, you take away nerves and blood vessels. So if you take away too many blood vessels, the nipple will die. So necrosis of the nipple is a complication of breast reduction. That is why it's not wise or not really safe to over-reduce. The other thing is the nerves to the nipple. If you take away too much breast tissue, you lose sensation to the nipple. The nerves to the nipple usually run from the 4th and 5th intercostal space from the outside in. Some nerves go near the ribs, some nerves go near the skin. When you lift the skin away, you automatically take the nerves near the skin. You're trying to save the nerves near the ribs. So decreased nipple sensation is a complication of breast reduction. You can also have increased nipple sensation, and the idea or the theory behind this is that the breast has been stretched, the nerves have been stretched so long with the weight of the breast that they no longer function. When you relieve the stress in the nerves work better, you have increased sensation. So that's a possibility. Inability to breastfeed or not being able to generate enough milk. They say that 60% of the people with this type of breast reduction should be able to generate milk, 40% shouldn't. Now, you could have the loss of the flap, the elevated skin. You can lose blood supply there and have a wound healing problem. You could have separation of the skin. You could develop a hematoma. A hematoma is bleeding underneath the skin. One breast would be swollen and big, the other one's small. Small hematoma, you let it heal by itself. Big hematoma, you got to go back to surgery and drain. Infection, abscess. Small infection, antibiotics. Abscess, you got to go back to surgery and drain the abscess. Hypertrophic scars and keloids. Now, the short scar is less likely the keloid than the horizontal scar because there are keloid prone areas of the breast, of the body. So the shoulders are keloid prone, the earlobes are keloid prone, sternum is keloid prone, and ribs are keloid prone. I did a lot of breast reductions on black patients and I always found keloids here and here. So that's why I wanted to eliminate that horizontal scar. Much less common to get keloids in the center of the breast. So that was a big reason why the short scar I think is a better operation. Another reason why the short scar I think is a better operation, I think it generates a better shape. If you think about it, if you take tissue from the middle and pull things to the side, that's how you make a cone. That's how you make a projecting breast. If you cut horizontally and pull down, you're making a flatter breast. If you pull things in together, you're improving the skin on the lateral side of the chest. If you pull down, you're making this bunch up and worse. So I think those are reasons why the short scar is a better procedure, and the additional reason has to do with the strength of the bottom of the wound. The less strength you put on the bottom of the breast, the stronger the bottom of the breast, the less likely the breast is to fall down at a later time. So all those reasons are the reasons why I think the short scar is a better procedure than the typical wise pattern scar. Now, other complications would have to be, the complications of anesthesia, pulmonary embolism, DVT, laryngospasm, atelectasis, pneumothorax, pneumonia, allergy to anesthesia. So I think those are the complications and things you have to think about with the breast reduction surgery. But again, the reason why the breast reduction surgery has a high patient satisfaction is because it does such a nice job on relieving the back, neck, and shoulder pain. So this is an example, of the breast reduction, and you can see the nipple here is by the elbow. If you go to this fixed point, the xiphoid, the bone here, there's no breast tissue here, there's no cleavage. Now we go to the same fixed point, now we have breast tissue above that and cleavage. If you shape the cleavage to look like an implant, the breast reduction will look like an implant. So this, person, doesn't have a A-cup breast, but her back, neck, and shoulder pain were relieved. Here's another example. And again, you can see the nipples are, one is below the level, at the level of the shoulders. You can see this breast goes to more to the side, this one's more straight, so it's still, this one goes aside more straight. You can't change the morphology of the chest wall, so it's going to be the same way that it was before. But again, if you go to the xiphoid, there's breast tissue above it, now there's none. Another example, and again, nipples are below the elbow. Afterwards, nipples are about halfway up the arm, near the level of the inframammary fold. The scar is here and here without the horizontal scar. And again, there's cleavage above the xiphoid, where there was very little breast tissue above the xiphoid before. Now this patient is a breast lift, or a mastopexy. I'm trying to show that you can use the same skin operation and just not remove breast tissue